This is Pet Life Radio. Let's talk pets.
And we are live here on Pet Life Radio. Yes, that's with Dr. Jeff. And I'm here just waiting for my father. Oh, there we go. And number one here. Good morning. Good morning. How you doing, guys? All right. So anyway, here for you, here for your pets. You know the drill. If you need me, just ask away. We'd love to hear what you want to talk about. I, of course, have some topics that I wanted to cover, but I only do those if we get enough good calls from you. So let me know. For you, those of you on Pet Life, you can either join us right here on Pet Life Radio, ask away, or call us toll free 877-385-8882. Once again, 877-385-8882, and we will help you just with what you need help with. So I want to wait till we get more of you online because I want to talk about this. I want opinions, some stuff you can think about. Also, I realized that I may not have wished all of you moms a happy Mother's Day last week. So I'm going to hope it's a happy belated, hope you had a good Mother's Day with the fam, whether it's your barbecues or whatever you did. I hope you had a lot of fun. So let's see. So what is MSNet Babe? Talk to me. No first names here. Come on. MBell76BS. I don't know what BS. I know what BS stands for. You have to explain what your BS stands for. So Cloud Teacher Michelle Lewis, hello. And more of you coming on. As we get more of you, I'm going to ask a question. Maybe we'll start the second half with it because I want you guys to let me know. So good morning, everybody. Good morning. Hope you're having a great day. And wherever you are, our day started. We've been having if you're in LA, you know what I'm talking about. We're having some really weird weather in LA because we've had some rain in May. Usually by May, it's usually gorgeous. Then we had last weekend was gorgeous. Super hot, super nice. Everything was great. And I think, now we're getting California weather. It's been overcast. It hasn't burned off. So, I walk my dogs, a few times during the day, but my last time is like usually 10 p.m., maybe 10:30. And I have 5 of them. And if I have to still put like a sweatshirt on or a hoodie or something, it's getting too cold. I like it when I can walk out there, kind of like Florida, where our producer Mark lives. They can be wearing shorts at 10:30 at night and still good. So Shecky, Shara. So this is my sister, one of them. The other sister, Jill, the other Beth hasn't shown up yet. So that's kind of weird. All right. Anyway, so one of the things I want you to think, maybe we won't talk about it now. I want you to think about it and think about the pros and cons. But in the meantime, I want to add some tips. Speaking of weather, as we're getting a little warmer, hopefully, there are, we've talked about vaccines many times, what I call core vaccines, other vaccines that are really a necessity, and it varies from where you live. Well, what I found is that I just had a client come in the other day, and she wanted the Lyme vaccine called Borrelia. I'm thinking a lot. We don't do Lyme. So my first question was, are you traveling during the summer? She goes, yeah, we go back east for the summer. I go, so this is an informed pet parent. And yes, if you go, especially the Northeast, if you're going to New York, Connecticut, Boston, all these places where we see the Lyme disease, then yes, you want to get the shots in now. Because if it's the first time they've gotten them for this particular dog, it is, because it's a young dog, that we're going to have to give 2 about a month apart. And then we start going it once a year, depending on lifestyle, depending on how much traveling. So I don't recommend that vaccine for people here. But if your dogs are going to be exposed because of location, and certainly back east, especially the Northeast during this time of year, that is a problem. Yes. So talk to your veterinarians, please. If you have travel plans, there are some diseases where you're going to see, major ticks, heartworm disease. That's a biggie. We don't really have it terribly here, but we're seeing more and more mosquitoes. But, oh God, in the Northeast and the South, Florida, it's coming all the time. So that's what we need to do. We need to get our pets protected. So if that's the case, you want to start the prevention now for heartworm. You want to start the prevention now for Lyme disease. So if you're going to start hiking a lot because of the warmer weather, then yes, you want to think about the rattlesnake vaccine. So this is like pre-planning. Speak to your veterinarian now. And if you need these shots, or if you're having travel plans during the summer, or your lifestyle is going to change because of the warmer weather, sit down, have a quick discussion, and find out what vaccines that were not core. You don't need them regularly, but you need them. Okay, my 4-month-old puppy. I love these. Thank you so much. My 4-month-old puppy tried to catch a bee and got stung in the lip. You think out the string is hard to get swallowed. Okay, so this happens a lot. So don't feel badly. And guess what? It's going to happen again. So if given the opportunity, they don't learn. That's a joy for them. So first of all, as you already did, most importantly, try to get that stinger if you can find it. The problem is that stinger, it's like a little comma. You sometimes miss it. So I recommend if there's an area of skin, take like a credit card and brush it against the lip, lift up there. A lot of times the stinger is inside the mouth, and sometimes it'll catch on to that little stinger and pull it out. If you can't find it, or if it's maybe not even there anymore, then importantly, cold compress is good. Benadryl. Benadryl will help. Benadryl at 1 milligram per pound Benadryl per pound body weight. So 15-pound dog, 15 milligrams. Your standard Benadryl tablet over the counter, diphenhydramine, is 25 milligrams. So you might want to give half, 12.5 milligrams. You can also get children's Benadryl, which is 12.5 milligrams per teaspoon, which per ml, there are 5 mLs in 1 teaspoon. So you're looking at 12.5 divided by 5. So it's basically 1.25. So 2.5. So that's how you can figure it out. If you have a dog that's 2.5 pounds or 5 pounds, you want to give like 3 ml. So, 3 ml actually is 2 ml. It would be, that's like 2.5 times 2. That's 5 right there. So just do the math and remember that 12.5 per 5 and in the children's liquid, and a full adult is 25 milligrams. Now, if you have access to prednisone or prednisolone, that would be good, as well as an anti-inflammatory. Typically, it's 1/4 milligram per pound. So if you have, a 20-pound dog and you happen to have 5 milligram pred sitting around, you can give a prednisone also. But it usually it's going to go down. So it's cold compress like ice on the area. A Benadryl will help. If you have pred, you can give a pred. Do not use other anti-inflammatories. The only non-steroidal anti-inflammatories off your shelf that you could do if you want to decrease some pain and inflammation is good old-fashioned aspirin. Not Tylenol, not Advil, not any of those, not naproxen. It's got to be good old aspirin, and it's usually 1 adult aspirin, that's 325 milligrams, okay, for every 60 pounds of body weight, which means a baby aspirin or an aspirin people take for their heart, 81 milligrams, 181 milligram for every 15 to 20 pounds of body weight. So keep that in mind as well. So, and it's not something you want to give all the time. It's a 1 shot, maybe 2 shot, 2 aspirins, and that's it. Otherwise, see your vet. All right. How do I help my golden doodle lose weight? Well, one thing, we have to understand one thing about dogs, puppies especially, that the needs of a puppy is almost 1.5 to 2 times greater than an adult dog of that same weight because they're still growing. What we do is, so we're feeding this puppy food. We're feeding the amount that they love. It's perfect. Then all of a sudden, they're starting to the end of their growing phase. And if you don't make an adjustment and drop down their food requirement, and they're eating the same thing amount as a growth dog, then they're going to gain weight. And trust me, as all of us know, it's a lot harder to take it off than it is to put on. In fact, putting it on is easy and kind of fun sometimes. Taking it off is not so easy and certainly not fun. So prevention is the key. So if you want to do your best to prevent it by starting as they're getting past that adult age, like 5, 6, 7 months, depending on the dog, 8 months, start cutting back puppy diet and going on to either an adult food or cutting the volume. Once you have that puppy, or no longer a puppy that is already overweight, no magic. It's no magic. Reduce the calories, increase the exercise. And what we find is that the bigger a dog gets, the less they want to do. The less they do, the bigger they're going to get. Initially, the calorie reduction is the most important thing. And then as they're starting to feel better, or you have to push them at the beginning to exercise, get them out there, chase the ball, go to the park, whatever it is. I recommend typically, a good gauge of weight loss is basically 1% of body weight per week, about 4% to maybe 5% per month. So it's a slow process. You reduce anywhere from 25 to 30% of their caloric load. And one of the biggest mistakes that we all make, trust me, we all make, well, not everybody, but I've made too. We mostly feed our dogs through eyeballing. We fill that scooper, we fill the whatever it is, and we throw it in their bowl. we have no idea exactly how much we're feeding them. So what I recommend is the following, is you want to take your eyeball scoop, but instead of putting it in a bowl first, put it on a kitchen scale. Know exactly what it is. Let's say it comes out to 10 ounces. I don't know, just coming up with a number. Okay. Then if you want to get down 30%, so you're taking 3 ounces away. So that means you have to go from 10 ounces down to 7 ounces. And you want to measure it each time. But you want to get from here to here, right? From this 10 down to 7 in about 7 to 10 days time. Don't do it all in one meal. They'll recognize it. But if you do a little bit each meal, it'll help. They'll ease into it and they'll do fine. Easiest over-the-counter ear cleaner for dogs. That's a good one. So there are so many on the market. I will say, of course, my ear cleaner called Hear You Now, available on Amazon or at my office. It's good, or Shopify. It's really good. But no, trust me, there are a lot of good ear cleaners. What I found, the way they work best is if you use them. If you don't use it, sitting on yourself, I have an ear cleaner. Oh, when the last time you cleaned your ears? About, I don't know, a month ago. No, it's not going to work. So you want to get into a routine, especially if you have a dog that gets ear diseases. You want something that's mild. You want something that they're not going to hate. And by the way, let the ear cleaner do its job. In other words, you pour it in liberally, let it pour back out of the ear. And with the intact eardrum, it's like a vessel, a cup. It's going to fill up and start pulling over. At that point, you want to massage really, really vigorously from the bottom up. You'll notice a lot of the debris will start floating to the top. Then what I usually do is let them back off for a second. And if you want, you give them a real quick blow in the ear. And they'll shake their head like crazy. And a lot of that crap will just start coming out of the ear. Then you can, take your finger. You can use a swab, a cotton swab, which I'm okay with. But you got to learn how to use them. And depending on the size of the dog, I recommend holding it about maybe an inch to an inch and a half away from the very tip. And your 2 fingers here will stop the swab from going any deeper than that. And for most dogs, that's going to be fine. If you have a little teeny puppy, you got to go less. Speak to your veterinarian. But it is something that you want to get used to do. But it's a good idea to start them on a real regular program to get their ears clean. My 10-year-old Catahoula has an ear infection being treated. Yes. So once even with an ear treatment, depending on what treatment they use, some treatments like Ocernia and Claro, for example, you don't want to clean the ear while the medication is working. So hopefully they'll do a thorough clean before the doctor or the nurse, whoever it is, applies it. And after that, just sit back and keep the outside clean, but don't go in the ear. Here's another thing. And this drives me nuts. I know we've talked about this before, but I'm going to do it again. Most of the ear cleaners that your veterinarian is going to give you, all right, have a long nozzle, or they tell you to count the drops, or both. Put the nozzle in. If you put the nozzle in, then you can't even count the drops. You don't know how much you're putting. You're squeezing. You don't know. If you're holding it up on top to count drops, then it makes 10 drops, 5 drops, whatever it is, then it's not going to get down to where it has to get down. So my recommendation is that you ask your veterinarian, have them show you, much better way to do it, for a tuberculin syringe. Tuberculin syringe is a 1 cc skinny syringe. And instead of giving you counting drops, it'll be put 0.3, 0.4, 0.5, 0.6, up to about 0.8, and a giant dog, maybe 1 ml. Okay, the full syringe of the ear medication. And then what you can do is, so my instructions are put 0.4 ml, 0.6 ml into the ear once a day. Even ear drops that say to be done 12 hours, unnecessary. Once a day is going to work just fine. And you don't want to put too much crap in that ear anyway. So you do once a day, you do a measured amount. You put the syringe in just a little. You don't shove it all the way to the bottom, just in enough where you can't see the tip anymore. And gently push the minutes in. Why gently? Because if you have a good, nice, tight fit, and as he said, that ear canal is finite because it's got an intact eardrum. If you push that stuff really hard and it's created like a seal around your syringe, then you can actually, by pushing that stuff into hard, blow out the eardrum. So very, very carefully, just gently with your index finger, just put the stuff in, then massage it in. The dog will shake a little bit. If you see any excess, again, take your cotton swab and clean out the excess. So that is the recommendation. Then brought her back. They said urinary tract, but she is not urinating frequently. If anything, you want to try, they want to give her. Let me go. Maybe go, Michelle. I want to go back. Ear infection. Then brought her back. They said urinary tract. I don't get the two, but she is not urinating frequently. If anything, once or twice a day, they want me to give her Clavmox. I'm a little lost there. How'd you get from ears to a urinary tract infection? And what made them think urinary tract infection? Because there is no link, let me repeat that, no link between an ear infection and a urinary tract infection. So I'm concerned, was it a side note? Did you mention something about the dog drinking too much water, urinating frequently, something that led them to believe? And even if they did, I wouldn't give Clavamox for a urinary tract infection off the bat without testing the urine. Did they do it? Take a urine sample? Did they do what's called cystocentesis? Take a sample and send it to the lab? It's a good thought that I'm not saying it's not a urinary tract infection, but I wouldn't think urinary tract infection because of an ear infection. And I wouldn't automatically give medication for a urinary tract infection if you didn't test the urine. So that's unusual to me. Now, if they thought an ear infection, would Clavamox be a good medication on top of whatever you put it in the ear? Yes. And sometimes if we have a big problem, I will use an anti-inflammatory. Sometimes if it's really bad, the ear is red and inflamed, I'll even use prednisone orally along with whatever topical medication we put in. So find out about that and get back to you. There must have been some reason they thought urinary tract. Hey, Steph, how you doing? Bethany. Oh, there you are, B. Boy, Jill beat you this morning. Because she was lethargic, so he kept looking. I mean, typically, a urinary tract infection, the clues that you would see, drinking a lot of water more than normally, and frequent attempts to urinate, squatting all the time. Or, of course, if you're seeing some blood or something like that, yes. Or the urine looks different, then yes, 100%. But you got to do a urine sample. And I would even do an ultrasound of the bladder to see, is the bladder wall thickened? Are there crystals in there? Are there bladder stones? Something's going on if she's not feeling well. But I wouldn't necessarily go from lethargy to a urinary tract infection without evidence of a urinary tract infection or a urinary problem. So that's a weird one for me. All right, so let me take a quick break here because I'm running over. It's already 9:20. Time flies when you're having a good time. So while Mark is playing the commercials, I will stay on. I'll mute myself from Pet Life and we'll still talk a little bit. Don't go away.
Oh, sure. It's all fun and games until someone ends up in a cone. That's right. We're animals. Deal with it. Pet Life Radio. Let's talk pets.
Let's talk pets.
Let's talk pets
On Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
Hi, welcome back. Welcome here at Pet Life Radio. We're talking about a couple of my cases from last week. And Barney, the one with the very aggressive hemangioparasitoma, probably, again, we didn't biopsy it. I'm explaining why. A much older dog. What would be a more aggressive treatment of any of these? Well, A, it could be amputation. B, it could be radiation. All right. Chemo wouldn't help for this one. So we're looking at two pretty drastic treatments for an already 16-year-old dog. No, unless you have this academic urge to need to know, I don't recommend these fancy tests. Because if the result of a test is not going to change your approach to the case, then don't do the test. I mean, you could do it, spend the money. It's not going to change anything. But as I said, if you won't go to bed at night until you know what it is, you're not going to do anything about it anyway, then yeah, spend the money. But otherwise, it's crazy. So Barney, we did not. And I totally agree. I would not push him in. But from my experience, it's probably hemangioparasitoma because of the location, because what it'll look like. And I've removed many of them in surgery. Anyway, he came back in on Thursday for suture removal. Man, that thing was amazing. He is bending his arm. He's got more energy, and he's 16. I mean, you want from a big 16-year-old dog, but he's doing great. So those are the best things ever. Those are the cases, the happy endings. All right, two things I wanted to talk about. Number one, maybe I'll leave you at the end with the other one, the first one, because I want to know your thoughts, and then we can talk about it more next week. But next one is shock collars. I had a dog. First of all, let me preface this. I am not a fan. I don't want to say I hate them, but I strongly dislike them because they're only ever should be used by someone who is a pro at knowing dogs well, knowing how to use them, and who's going to tell you most of the time he doesn't use them. So that's an honest, really good, reliable trainer with a lot of experience. Put in the hands of a novice or someone who does not really know how to use them will often reverse. And in this particular case, it led to the death of a dog because of euthanasia. And again, I get it and I supported it, but they went to a trainer who used them for basic stuff. The dog is a very tough, aggressive Doberman pinscher. Very tough. I mean, he would go after me. Now, the only two people that can really handle him was this woman who owned the dog and her dad. She still lived at home, her dad. And other than that, you have to muzzle him. He was really tough. So anyway, they were, the holidays, and they sent the dog back for another 2-week session of training. When they went to pick the dog up, and this trainer was one of these guys using shock collars, and the dog was in its cage. It was not really pretty. And the dog literally had to put him there because the dog was very, very aggressive with them and the other dogs. So shock collars were the answer, but it wasn't the answer. It made it worse. Now, when the dog came out and back home, now, even though it was great, typically with this girl and her dad, he started attacking, biting them as well. And started looking at them. The brother came over who he loved. She said, the brother didn't live at home anymore, but loved the brother. The brother was in playing with him, and he started to growl at the brother. So he carefully turned around to walk out down the hallway. The dog ran after him, jumped on him, and bit him in the back. That is really weird. That's an attack. That's not, leave me alone. You're getting too close to me. You're getting close to my toy. All right, I don't want pets now. When a dog runs after somebody, that is really bad. My hunch is that dog was so affected by the improper use of the shock collar. What was the association this dog made? This dog made the associate that you brought me here. You, meaning mom, the dad, the brother. That's why I'm angry, because you brought this pain on me, not necessarily just the person delivering the shock. Because remember, the shock is being remote. So now the dog is associated being in this place with the family who brought me here. It got really ugly. I mean, I tried to attack the girl. When the dad came in, he took the bites from the dog so the girl can get out of the room. It's crazy. And this is like Cujo. So anyway, in good conscience, you could not take this dog to another family. You did not want to put it, because it would have been destroyed anyway, and maybe not so nicely. And they made the very tough decision, and I did not disagree, that they really need to say goodbye to this dog. Anyway, the good news is they just brought a rescued puppy that is so cute. And, again, it is the looks on her face to now have a dog who now she can pick up and she can cuddle and she can lick her in the face. It's such a huge difference. Collars have been vibrate. Okay, so if you have vibrating, what I recommend, I like, is a citronella collar. Citronella is a little device they wear when the dog barks. And it's not the only collar, the vibrating ones too, that are accepted by a lot of humane groups. But the citronella, with the vibration from the bark, the vocal bark, the chords, it emits a citronella spray. What it does, okay, it hits all 5 senses. First of all, when it sprays, they feel it, okay, on their chin. Number 2, they see it because it brushes against their face. They hear it because it wishes, okay. They smell it, and finally they taste it. Or they hate it. So all 5 senses are gone, and they hate the taste and the smell of the citronella. When it's used properly, and what I found is that when the owners put the collar on, they don't even have to refill the citronella liquid anymore. Just wearing the collar, the dog saying, oh, okay, I guess I can't bark. So that is a successful device. It doesn't hurt them. They just don't like it. They don't like the smell, the taste. They don't like they don't like seeing that spray across their face. So that is totally fine. And that's why everybody really likes it. Or maybe just some good training from professional. Absolutely. Absolutely. But most of the trainers I work with, except for maybe 1 or 2, will approve of a shock collar from a novice or someone who says they know how to use it, but they don't. It's never an excuse. It's never like, I ran out of every other thing to do and I'm at a loss, so I'm going to do a shock collar. No, because you know that shock collars often backfire and it makes the dog worse and not better. So, but I do like the citronella collars are really good. A vibrating collar is good too, but it doesn't necessarily have the same. Now, also, there are other collars out there that don't necessarily deliver a shock. I have not tried them, so I don't know personally, but I've heard that they're not as bad. And they just, like women, I don't do this as much. Maybe you do. But guys, I mean, you want to test your 9-volt battery. How do you test your 9-volt battery, right? You take it, touch it to your tongue, okay? And it gives you that little buzz. And if it's a stronger buzz, it's still good. If it's weak or no buzz, you need a new battery. There are collars that deliver it's not a shock, it's a little vibrate, but that little buzz. And those might be okay. Again, I have not used them myself, so I don't know. I've never spoken to anybody who has, but I understand from the humane groups that it is an alternative. Preferably, I like the citronella the best because everybody agrees that is, if it works, it's the best approach. Another one is a penny can. I'm sure you've heard about that one. There was a group out there that had these little devices. It would look like a penny, but it was just a noisemaker. And you would toss it not at the dog. Let me repeat, not at the dog, but in the dog's direction. Okay. And that would stop them. They hear it, they see it go by them, and it stops them from barking. Sometimes they may even chase it and start playing with it. But that is also a better alternative than any kind of shock delivering collar, which, as I said, I am not a fan. I'd love to know if any of your experiences with used one or had a trainer that used one, how did it work? Did it work well? So I'd love to hear from you. All right, we're out of time, but I'm going to leave you with something to think about. And I want your responses next week. So even if you have anybody that you know that does this and they want to chime in, I'd love to hear, because there is definitely the disagreement between the animal person like I am and animal people that are more behaviorist trainers. And well, we'll get into the discussion next week, but I will tell you this. I want your opinions. How do you feel about your dogs sleeping in bed with you? Is it a pro? Is it a yay? Is it a nay? If so, or if not, why? And more importantly, what type of behavior issues have you noted for those that have allowed their pets to sleep in bed with you? So I don't want answers now. I want you to think about it. I want you to come back and we'll talk about it next week. But I certainly have my feelings. I think you know them already. So, and I'm sure you've seen pictures of my bed and what it looks like. But it's something that I'd love to hear comments. I'd love to hear the pros and I'd love to hear the cons, because I just don't know how many of these behaviorists, many of them are cons, are they right? Maybe I'm doing it wrong. I don't know. But anyway, so have a great week, everybody. If you're here in LA, I see the sun trying to come up, and I'll be here next week. And is next week already? Today's the 8th. Yeah, next week is Memorial Day weekend. I'll be here Memorial Day weekend. Even if you can and you are traveling, if you can hop on, that'd be great. But I don't want to not do this. The only time I won't do the show is if I'm not in town. And as you know, if I'm someplace and I'm not in an airplane getting there or coming back from, I will do the show from wherever I am. So you've seen me come from Cabo, Puerto Vallarta. So I love doing the show. I love being there for you. So if you have questions, save them up. But do think about, does your dog sleep in bed with you? And let me know why or why not. See you next week.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.